is Daniel, a registered kinesiologist and clinical exercise psychologist, associate professor, faculty of kinesiology and physical education at the University of Toronto, a co-director, Prehabilitation Program and University Health Network. And I'll throw it over to you to get started, Daniel.
Great. Thank you so much, Mackenzie, for having me today, and to the entire Wellspring organization, whom I have near and dear to my heart from many years of collaboration, including my time as an exercise leader with Wellspring. And just a minor correction in the introduction, I'm actually an exercise physiologist, not a psychologist, but do love reading a lot about exercise psychology as well. I will jump into today's conversation topic, which is prehabilitation. And for many of you, I'm sure you're familiar with the concept of rehabilitation, which is something that you would do to help you recover from an injury or a surgery or a particular treatment that has some sort of negative impact on your overall well-being. Well, the idea of prehabilitation actually takes you to the other side of that event. It takes you to getting ready for a potential health stressor. So I want to talk about getting ready for your various treatments or for what may be next for you in terms of your journey with cancer. So very simple presentation outline. I'll talk a little bit about what and why prehabilitation is and what and importance within the context of cancer. I'll discuss how we do it at the University Health Network in our programming, as well as what to consider, with a few general high-level tips for some of the listeners today and those who are watching the recorded version in terms of what we may focus on and how we may approach a prehabilitation regimen. And then finally, I'll wrap up with some discussion, and hopefully this generates a few questions that you can ask me at the end of the talk. Okay. So off to the races, shall we say, with the conversation today. And this is a picture of the Boston Marathon. People getting towards the end of the line here. And some you can see have their hands up and they're celebrating the accomplishment of this psychological and physical feat, feeling good about what they've just done. And others probably not feeling so great by the end of this race, maybe perhaps because training didn't go so well, they had an injury that was lingering, or whatever the case may be. But irrespective of how they finished, they all prepared in some way, shape, or form. And perhaps those who are ending the race with their hands up in some sort of celebratory fashion prepared a little bit better than those who are struggling across the line. So this is one maybe analogy we can use to describe the role of prehab, and that is, you've got a major event that's coming up. What should you do before it? Is it worth preparing, or can you just go into it without much preparation? In my world of work as a professor at the University of Toronto, we have a number of students, obviously, who go through their own difficult challenges throughout their academic journey, including exams. And as we probably could appreciate, if you go into an exam well prepared, you're likely to get a better grade afterwards. End of the day, you're probably still going to write it no matter what. However, those who prepare well will do better in the end. But what about the situation of surgery? This really is a physical and psychological stressor in and of itself. And can preparing for surgery actually improve surgical outcomes? In maybe not exactly the same way as the examples I provided previously, but perhaps in very important ways unto themselves. And so what am I really talking about here? I'm talking about, generally speaking, health behaviors that we believe contribute to physiological and psychological fitness, which can overall contribute to performance outcomes. And the performance outcomes, as you may guess from the examples beforehand, can be things like sport or athletic or other recreational activities, or they could be performance on exams, for example. And you definitely want to go into these types of events or activities having physically and mentally prepared. But surgical outcomes, again, the real backbone of where we understand prehabilitation's value to be. And when we think about different stresses that could be placed on our various systems, exercise and surgery are actually similar in many ways, where there are a lot of physiologic pathways that are increased or activated in the presence of high intensity or stressful exercise events that similarly occur under the stress of surgery. So really, why would we prepare for one and not the other? And in fact, in a recent journal in the in a recent paper out of the British Medical Journal, the authors likened major surgery to a marathon, and they say both require training. So I think we really have to figure out what we need to do to go into the operating room to make sure that the outcomes are as good as they can be. So what is prehabilitation? I'm adapting this definition just modestly from a great colleague and friend, Dr. Julie Silver. And she describes prehabilitation as a process that occurs between the time of diagnosis and the beginning of acute treatment. It includes assessing the whole patient to establish a baseline functional level to identify impairments and to establish a baseline functional level, identify impairments, and provide targeted interventions that improve a patient's health to reduce the incidence and severity of current and future impairments. So really, it's the idea of getting ready for treatment and to improve outcomes after treatment. It's not necessarily something that is reactive, but rather something that is proactive. So I want to think a little bit about this idea of approaching surgery. And this is a conceptual framework that's been used to describe prehabilitation probably at the inception of its major growth in the clinical research field. And in this particular graph, I want you to think about this hashed line as a threshold of functional independence. So if you fall below this, life becomes a little bit more difficult to do on your own. And this point here, this inflection point here, is at the time of surgery. And the solid line represents people who might approach surgery without doing very much beforehand, in ways in which you might just kind of carry on with your day-to-day life up to the day of surgery. And what surgery does is it has a pretty significant impact on your overall health. You decline in your overall functional ability. As you recover, you again approach this functional threshold and hopefully get back to baseline sometime after surgery, and perhaps with a little bit of help from rehabilitation. Well, the concept of prehabilitation really is the idea of adding a buffer at the time of surgery through health behaviors so that you actually increase your overall health status. And although you may fall with a surgical insult or treatment-related insult to your body, you don't necessarily fall below the threshold for as long. And in not falling below the threshold for as long, you can then recover back to baseline a little sooner and perhaps even greater than baseline and have optimal outcomes over the long period of time. Now, what we've known in prehabilitation in terms of our approach towards surgery is that not necessarily is it that everyone stays at a static or at a stable health level. In fact, many people, as they approach surgery, actually decline in their overall health. And this could happen for a number of different reasons. This can be because of the stress that's associated with an imminent treatment. It can be because of progression of disease. It could be because of additional treatments that happen before surgery. There's so many reasons for why health can actually decline in a short period of time between when one is diagnosed and the surgical date. So in fact, that buffer that we have becomes even more important because there probably is an approach towards maybe this critical threshold that we want to avoid. And while we definitely know that health declines over the preoperative period, frankly, some people actually are diagnosed at a time where they are already quite frail and just hovering at this threshold, again, making the buffer even that much more important. So when we're talking about prehabilitation, really, what are we talking about? How do we create this buffer? Well, we often refer to prehab as a multimodal intervention. And what that means is we're really trying to harness the synergies or the combination of different intervention approaches to maximize the gains in health that we can try to achieve over the preoperative period. And so what we're really trying to do is make the whole really greater than the sum of its parts. And what multimodal prehab often comprises of is medical optimization, including perhaps an assessment by a physician or other healthcare professionals to see if there are any other underlying causes for illness or things that could complicate recovery. And this may also include the optimization of medications, including changing prescriptions or deprescribing different medications. For much of the literature in the last little while, exercise has become a central focus of prehab and typically includes aerobic and resistance training to reverse or prevent deconditioning, as well as some very localized specific exercises to address the tissues that are likely to be affected during surgery. But ultimately, the regimen of exercise is going to be individualized based on the type of surgery, the medical history of the participant, as well as the preferences and barriers to exercise. From a dietary standpoint, what we're really trying to strive for is the avoidance of malnutrition or some sort of insufficiency in various dietary components or macronutrients, if you will. And we really want to make sure we have sufficient calories to sustain the stress of surgery, and not necessarily just total calories, but also to have enough protein, because protein becomes a metabolic substrate that becomes broken down over a chronic period of fasting and under stress. And so we want to make sure that our body is supporting what we often refer to as anabolism or muscle building rather than catabolism or muscle breakdown. And that would be supported by protein, whether achieved through your diet or in supplementation. Psychological interventions within multimodal prehab often include things that would reduce stress or manage more acute psychological issues like anxiety or distress. They can often be provided by nursing, psychology, social work, and a number of other health professionals. But really the idea is making sure that you're mentally prepared for surgery, but also you are mentally prepared to make the changes in your lifestyle to add diet, add exercise to your daily routines. And finally, smoking cessation or the cessation of other adverse health behaviors is extremely important. If there could be one recommendation for those who smoke in terms of prehab intervention, first thing would be to stop smoking, given smoking's impact on surgical outcomes, which is often quite negative. In terms of multimodal prehab, we want to also add this concept of multiphasic prehabilitation. And what I mean by multiphasic prehabilitation is that sometimes there are multiple windows in which you want to prepare for an imminent treatment. So as many on the call today would appreciate, there may be a phase in which you can get ready for surgery, but there may often be a period of time in between surgery and a subsequent therapy, often what we refer to as adjuvant therapy. And the needs of the individual will vary prior to the treatment. So for example, in the face of surgery, we may be focusing on aerobic conditioning and musculoskeletal strengthening based on the location of the surgery and the impairments that it may result in. But in advance of adjuvant chemotherapy, for example, perhaps we increase the focus on aerobic training to counteract the cardiotoxic effects of various chemotherapy drugs. And we also have to take into consideration some of the localized impairments associated with the previous surgery. So prehabilitation in these different windows may actually look quite different depending on what patients have already gone through and what they have yet to go through. And finally, I would say that multimodal prehabilitation is both multiphasic in its approach over one occurrence of cancer, but also may be recurrent from the standpoint that prehabilitation may be needed for a recurrent or secondary cancer. So it really should be a part of the overall journey of someone who's been diagnosed with cancer as a primary diagnosis and as a recurrent or secondary diagnosis. So what do we know about prehabilitation in the scientific literature? Certainly we have a strong evidence base for the value of rehabilitation after treatment. And I've been very fortunate to be a part of the growth of that literature to some extent. But in turning my attention towards the preoperative or the pre-treatment side, the evidence is definitely growing and growing rapidly. And in fact, not too long ago, in 2005, as I indicated, that was probably a really hallmark time as Dr. Carley and his colleague, Dr. Zavorsky, identified prehab's conceptual framework. But since then, probably 10 years later, there's been exponential growth in the field. And really right now, what we're seeing is that there's a ton of prehab research going on, and a vast majority of it is occurring in people with cancer. And this summarizes a lot of the literature in just a couple of bullet points, and I've identified some of the citations here on the right. But let me just try to make a few things very clear. Based on the evidence, prehabilitation is feasible and safe. And I think it's important to note that it's safe even when using high-intensity types of training regimens, like high-intensity interval training. It's also very safe in people who are identified as being at high risk for surgical complications, including those older people with cancer. So again, feasibility and safety have been examined, and prehabilitation has demonstrated that it is both indeed feasible and safe. In terms of its benefits for participants, we definitely see that there is improved pre and post-operative aerobic function. And this is really important because aerobic capacity is related to surgical outcomes and recovery. Quality of life is improved as well over the surgical journey. And some elements of overall health that relate not necessarily only to the participant, but also to our health system include improvements in length of stay, i.e. prehabilitation has been associated with shorter lengths of postoperative stay, as well as a reduction in surgical complications. And these impact the health system because they generally will reduce the overall cost of treatment such as surgery, because there's not as much burden on the postoperative time in hospital and additional care. So despite the fact that the evidence is indeed growing, there is a lot of push for integrating prehabilitation into general clinical programming for people who are about to undergo surgery. And there are a number of methodological limitations associated with this area of research. But in general, we're finding that there is moderate to good quality study. There is generally overall a moderate to good study quality across the literature, not perfect, but certainly getting better. And for many, it supports the idea that we really should be moving towards preparing our patients for surgery better than we currently are. So there are recommendations that are moving forward that support the integration of prehabilitation prior to surgery in cancer, but also for all people who are undergoing surgery. Now, while the evidence and the research is contributing to various guidelines and recommendations for prehabilitation, I think it's worthwhile highlighting some pieces of the evidence that speak to the experience of prehabilitation. I've taken a couple of quotes here from my doctoral student, Priya Brambat's master's thesis, and she looked at the prehabilitation experience for women with breast cancer about to undergo breast cancer surgery. One patient stated, "I benefited a lot from prehab because it caught me in that time just after diagnosis when things were pretty scary and pretty awful. And I felt like prehab was one of the key pieces of my plan for positivity during this whole thing because it was setting a tone for recovery." Another patient stated, "Prehab was a really good impetus for me to get going on some positive lifestyle changes that would bolster me through some very hard times." So again, there are two key things here that I think are worth highlighting. One is the sense of control and being able to set a tone for a positive experience, as well as getting started on health behaviors that we would hope are persistent after surgery and make sure that the cancer survivorship experience overall is improved. So I think it's important to hear what some of the patients who are participating in prehab say, but I think it's also important to hear what the surgeons are saying when their patients participate in prehab. And again, I've derived a quote here from one of our recent studies where the surgeon said, "The patient had a bit of a difficult time with chemoradiation and had lost quite a bit of weight. Because of this, we referred him to our prehabilitation program. And in addition, we delayed his surgery by a couple of weeks to give him a little further time to recover. This, I believe, was beneficial in terms of both his energy and functional status. And his weight prior to surgery was 56.6 kg, up from his lowest extent at 50.5 kg. So, again, I think there's some indication here that there's real great value in prehab for the surgeon as well to ensuring the positive outcomes for their patients. So what are some considerations for prehab? Well, I'll start with exercise because that's really my area of focus. And I think at the heart of it, we want people to be as active as possible, including routine aerobic and resistance training. As I mentioned, high intensity training is often used in prehab because high intensity training generally can advance your cardiorespiratory improvements a little faster than maybe the conventional moderate intensity continuous training that people might do, such as going for brisk walks or going for, light jogs or cycling. That high intensity type of training really can improve your aerobic fitness quite quickly. And again, it's important because sometimes you only have 3 to 4 weeks prior to surgery to make some of these aerobic gains. So something efficient and intense often is used in prehab. I think you also need to make sure that you consider both what happens locally and at the whole body level. and you want to definitely think about what needs to be done to minimize or prevent a negative impact on both local and whole body physiology. And I'll talk about that in my next slide as I kind of work through this. I should note also that exercise may be easier before treatment due to the absence of treatment-related side effects. In fact, for people who prehab, they really haven't necessarily had always a lot of symptoms associated with cancer or any other treatment. So this may be the best shape they are in for a little while, because cancer treatments can be so difficult to go through. So while you are in reasonably good shape, it might be a great time to invest in your health through a fairly intense exercise regimen. On the other hand, it's important to note that exercise could be possibly tougher due to some of the competing activities over that short period of time prior to surgery. We know that you've got 4 weeks before surgery and you've got a lot of things going on through your mind. Can you add another lifestyle change into the middle of all this chaos? And how difficult would that be? So I think there are some good things about that pre-op period and some difficult things about that pre-op period. But if we can, we really want to harness it to make sure that we invest in our peri and post-operative health. And ultimately, when it comes to exercise, a professional really can help you create an exercise prescription that's ideal and tailored to your needs, both now and after treatment. Kinesiologists, physiotherapists, exercise physiologists are probably the ones that we often use the most in institutions and programs that I work closely with. They certainly are the ones that are often used in the research. But depending on the location, sometimes occupational therapists, personal trainers could be adequately prepared to support you in the prehab intervention as well. And again, prehab can happen pretty much anywhere. It can happen in your local gym. It can happen at home with a trainer or without a trainer. You can do online classes. So there are lots of options to do exercise. And maybe just to touch back on this idea of localized versus whole body or systemic benefits, I just want to maybe provide a bit of an example here of someone who's injured their right leg, and suppose they need to have surgery on that right ankle to repair it. Well, perhaps we would definitely want to focus on those local tissues, because those are the ones that are going to be cut, and those are the ones that may require immobilization and over time may be deconditioned. So having a bit of a buffer will be important there. But it's not just that joint that's affected. It's not just that region, because there are a lot of compensatory areas of the body that have to manage the stress that this injury and related treatment will subsequently cause. So for example, do we have the sufficient arm strength to be able to use crutches or a wheelchair? Do we have sufficient upper body strength to be able to pull ourselves out of bed or push ourselves off of a chair or do the things that we need to do when we're not able to weight bear on both legs? Do we have the appropriate balance with using assistive devices for walking or what have you? So you can see that it's not necessarily just the ankle that we need to think about here, but it's also the other areas of the body that will be compensating for not being able to walk and being compensating for having to weight bear. We also need to think about the other side of the body. It's going to be doing a lot of the heavy lifting if the right ankle is injured. So again, working on this side to make sure that we're able to support the body. Again, as I mentioned, preparing for assistive devices. Cardiorespiratory conditioning is very important because, as you might expect with an injury, you may not necessarily be as active as you otherwise would like to be. And if you're not very active, you can actually have reductions in your overall aerobic fitness. And then how do you feel after an injury? How do you feel while you're going through treatment and recovery? It can often be quite stressful. Exercise is a very, very powerful anti-stressor. So I think we want to make sure that we consider all of these different approaches when we're putting together an exercise program prior to a treatment. To turn our attention from exercise over to nutrition, from a prehabilitation standpoint, there are generally 2 main goals. One is, as I mentioned previously, is to avoid malnutrition, and that is an insufficiency of essential nutrients. And also, we want to promote anabolism. I've spoken about these earlier on in the presentation. Our main strategies to achieve these 2 goals are to ensure that you have a healthy diet. And here, what I've done is I've put up Canada's Healthy Food Guide. Again, the majority of your meal should come from vegetables and fruits, some from protein, but again, not a majority of your meal would be protein, but then whole grain food should also comprise about a quarter. So a healthy diet, as per Health Canada's food guide, is fantastic. Now, if there is still some insufficiency in nutrients, supplementation may be required. From the standpoint of prehabilitation, this often includes calorie supplementation or protein. And it really depends on your individual condition and the types of treatments that you may have, or the type of cancer you have, frankly. For those who have a difficult time chewing or swallowing, certain types of foods may just not be able to be digested so well. So you may need supplementation because of challenges with consumption or other physiologic limitations with absorption. So this is something that we typically do in consultation with a registered dietitian. From a psychological standpoint, there are a few main goals, as I highlighted earlier, which are to manage stress and distress, as well as supporting health behaviors. Within our program, these generally include counseling with a health professional, and we're very fortunate to have a psychologist as a part of our team to provide that counseling. And what they generally do is provide some guidance around how to manage stress on a day-to-day basis, discuss strategies to resolve more serious issues related to distress, but also from a health behavior standpoint, figure out ways to minimize barriers and maximize facilitators to engage in exercise and nutrition. So again, we can try to strengthen our body and mind in a very holistic way with strategies that make sure that we're able to sustain those behaviors all the way through our preoperative period, and hopefully over the long period after surgery as well. Some additional prehab components that we often include medical, which again revolve around making sure that we have a good understanding of other health conditions that could impact one's recovery from treatment, as well as changing or a deprescribing of various medications. We want to make sure that people stop unhealthy behaviors such as smoking or substance abuse. And in the literature, at least most recently, there's been a growth in evidence to support that ensuring that we have adequate and high quality rest or sleep prior to surgery in terms of its impact on surgical recovery. So I think there are a number of different areas that are contributing to overall health in the prehab space that are growing in terms of their evidence describing, in terms of their evidence of providing benefit to people who undergo treatments. So what is the bottom line? Really, we want you to be as healthy as you possibly can be before your cancer treatment. And frankly, sometimes it's going to be very difficult for someone to manage under the stress and chaos of a preoperative regimen, or especially if they're undergoing neoadjuvant treatments, and with so many other things swirling around in your mind. So you may really need to seek some support to help you achieve this. And very often this can be conducted in the community. Maybe you have to be your own bit of a general contractor to get the different parts of prehab that you may need. But really, we want you to be as healthy as you possibly can be using health behaviors such as exercise, nutrition, and psychological support. And where needed, additional medical and maybe other pharmacologic support. The growth of the field, as I mentioned previously, has been supported through some advocacy towards integrating prehabilitation into the standard of care. Here are a couple of documents that we as health professionals and researchers are using to make sure that we are doing a good job of integrating prehab. Some essential points from these include trying to identify the people who need prehab the most. If you are a very fit person going into surgery, for example, you're less likely to benefit from prehab than someone who may be going into surgery who's a little bit more frail. So when we develop rehabilitation programs, we typically develop them for people who are on the more unwell side. Prehab should be started as soon as possible. In fact, some people suggest at the time of a positive screen, just to make sure that you are ready for whatever may come. We always undergo an assessment at the beginning of a prehab intervention to make sure that we tailor the exercise, nutrition, psychological programming specific to the needs of that particular patient. And really, I want to stress that prehab is not necessarily something that's just for surgery, although that's where a majority of the evidence lies. You want to be as healthy as you can be for radiation. You want to be as healthy as you can be for chemotherapy or hormone therapy, because all of these treatments have pretty significant consequences to your overall health that if you go into in a healthier state, you'll probably tolerate those treatments much better. So that is a really fast recap of both the evidence and some implications, as well as some recommendations for prehab. And I definitely want to make sure I save some time for any questions that you may have. So with that, I'll conclude the talk for today. I'll put up my contact information here, and I'd be happy to answer any questions you may have. Thank you.